Hi Claire, this is Abby. I'm calling to let you know about your new admit you're getting. His name is Evan. He'll be in room 3. He's a 46-year-old male. He was just diagnosed with irritable bowel syndrome, and he came to the emergency department complaining of abdominal nausea. While in the emergency department, he said that he had not had a bowel movement for 4 days, and his abdomen is very hard, and he has hyperactive bowel sounds. He's diagnosed with a fecal impaction as well. I ordered a digital stool check followed by a tap water enema, and his medications available are Miralax and Zofran PRN. Do you have any questions?
No, that sounds good. So I have Evan in room 3, and you need me to do a tap water enema and a digital stool. Okay. And I will go in there now and assess him. Thank you. Hello, Evan. I'm Claire. I'll be your nurse today. How are you doing?
Not good.
How are you feeling?
My stomach hurts.
Can you tell me what's going on? He's having some problems. He's having some problems?
I haven't pooped in like 4 days.
Are you in pain?
Yes, it hurts so much.
Can you rate your pain on a scale of 0 to 10?
Like a 7.
A 7? Okay. I see here that we have a nursing diagnosis of at risk for constipation related to your irritable bowel syndrome. We are going to perform a water tap enema and a digital stool.
What's that?
Okay, so a digital stool removal is I'm going to manually remove the feces from your anal canal, and then after that I'm going to take tap water and I'm going to irrigate your anal canal to make sure that all the feces has been removed.
This is gonna suck.
Yeah. Do you guys have any questions?
Can I get a longer bed?
I will check on that. But before we do any of the procedures, could I offer you some prune juice? That might help with the
That'll help.
constipation.
Yes.
And then we also need to make sure that we're drinking lots of water. We need to make sure we're drinking at least 2 liters a day.
So I could look more like my
And then if you need to, I can take you to the bathroom and I can provide you privacy.
And
Okay, let's try that before.
thank you.
All right, Evan, if it's all right with you, I'm gonna go ahead and listen to your stomach to see if we're getting any activity. Can I go ahead and have you lift your shirt up for me?
Yeah.
All right, I'm just gonna lightly press on your stomach.
Alright.
All right.
I chose the second diagnosis.
What are you listening for?
I'm listening to his bowel sounds.
Interesting. I didn't know you had bowel sounds.
Yep, they're usually a high-pitched gurgling sound.
That's right. I sometimes hear my own now that I
think she
think
wants
about
us
it.
to be quiet.
I chose the second diagnosis.
You're fine.
Patient's blood sugars have been overly high. You might not want to say the second diagnosis, but what I would say is okay. Yeah. You just say we're supposed to focus on his blood sugar spikes or something like that. Yeah. Good.
Okay, the patient is experiencing hypoactive bowel sounds in all 4 quadrants, which does indicate that you do have, that you are experiencing constipation.
Oh, I could have told you that.
All right, the next thing I'm gonna do is I'm gonna go ahead and push on your stomach and just let me know when if you feel any pain, okay?
Be gentle, please.
Okay.
Yeah. Oh, it hurts.
Just take a deep breath for me. Alright, so you also are experiencing abdominal pain in all 4 quadrants.
It's not good.
And we will get you some stuff to relieve that pain, such as a heating pad, and we'll get you up and walking soon, okay?
Alright.
Alright. Hello. So I just wanted to let you guys know that our goal is going to be for you to have at least a small bowel movement by the end of the day.
Oh, that sounds awesome.
Does that seem manageable?
Hopefully.
Oh, that would be
Hopefully you can
amazing.
do that.
All right, that's what we're working towards.
Okay.
Hello.
Hi.
I'm Abby. I'll be one of your providers today. So we figured out what your abdominal pain is from fecal impaction. Do you know what that is?
No, what's that?
It's just a hard stool in your anal canal. So we're gonna work on getting that out for you. Something we can do to help with the pain. Do you like heat therapy? Would you like a heat pack for your abdomen?
I mean, I've never tried it. We can try it.
That would be nice.
Okay, yeah, we can try it. Also, there's a TV in here, so be sure to look at the channels. I can grab you a TV guide so you can focus on something other than the pain. What?
I think football's on, so that'd be good.
Oh yeah, perfect. Another thing you can do is it would help move your bowels if you walked around the room, maybe tried to get them moving, got a little exercise in, so we can try that too. Does that sound okay?
Yeah, let's try it.
All right, perfect. Call me if you have any questions.
We'll do.
Okay, Evan, I brought you a heating pad. Would you like to use it?
Yeah, it's worth a try.
All right, let's go ahead and lift your arms up. And I'll let that sit on there for about 10 minutes and I'll come back.
Is that hot?
No, it should be
It
okay.
feels good.
Okay,
Yeah.
if it's too hot, just let me know.
Yeah, just let me know if it starts bothering you or you want it taken off or anything.
Alright.
Okay, I'll be back.
See?
Alright, now that it's been a little bit, let's go ahead and take that heating pad off.
Alright.
Did it help you?
Yeah, I feel a little bit better. I'm still hurting some though.
Yeah. Do you want to go ahead and try and get up and try and walk a little bit? That would also help you.
It's probably worth a shot.
Okay.
Here, let me.
Do you need help standing up?
I think I'm okay.
Alright. Whenever you're ready. Are you feeling lightheaded or dizzy?
I'm doing okay. My stomach just still kind of hurts a little bit.
Alright, so I'm here after you had your heating pad and you've been walking around, I hear.
A little bit.
Has that helped?
Yeah, I feel a lot better. Still hurting some though.
Could you rate your pain on a scale of 0 to 10 now? Again?
Probably a little closer to a 4. Still in some pain though.
Good, good. I see that you have this energy drink here. Have you been drinking that?
Yeah, I got him that. I had to, he felt really bad. I just felt bad for him, so I stopped by McDonald's. I got him a drink at Walmart too. I got him some pizza just to make him feel better.
Well, unfortunately, with your new diagnosis of IBS, those things aren't the best for you.
Why? Those are bad?
Yeah, they can actually affect the symptoms of IBS and make it worse. So
That's
I think
my favorite.
We could figure out something.
I think that you guys would benefit from a dietitian coming in and discussing what you can and should not have with your diagnosis of IBS if you guys are open to that.
What do you think?
I guess. She is the nurse.
I will call them and have them come talk to you guys.
Okay.
Alright.
Thank you.
Thanks.
Hi Courtney, this is Claire on the med surg floor. I'm here calling about Evan in room 3, and I'm wondering if you could come down and talk to him and his wife. He just got newly diagnosed with IBS, and he needs more information about what foods and drinks he can have with his diagnosis.
Okay, perfect. I will make my way to room 3 to talk to Evan and his wife about irritable bowel syndrome, and I can help educate him on different foods to eat and what will help him manage his symptoms best. Thank you. Knock, knock. Hello. Hi, guys.
Hi.
Nice to meet you. My name is Courtney. I'm a dietitian here at the hospital, and I'm here to educate you on your new diagnosis of irritable bowel syndrome. I'm just going to go over some tips and diet plans that'll help you better manage your symptoms so that you can start feeling a lot better.
That'd be awesome.
So the nurse said that he can't have certain foods.
Yes, unfortunately, with irritable bowel syndrome, different foods trigger your symptoms. So we're just going to try to make a diet plan for you that'll help you feel better. And I know it stinks to get rid of those good foods, but I promise
it'll be worth it when you feel so much better.
Does that mean no more fried chicken?
Well, we're gonna go over everything right now, and I'll just
That's
tell
half the
you
reason I married her.
I'm sorry. I wish I could do more to help you without having you cut out your favorite foods, but this is the choice we have. So this sheet here, this is actually from a GI place in San Antonio, and they developed this diet for patients with irritable bowel syndromes. So you see what they want you to avoid.
He can't have ice cream?
In moderation, everything is okay, but that is one trigger that might worsen your symptoms. So you just have to
only a
think
double
about.
scoop?
What are you gonna do?
We'll go over all of this with
Okay.
you. So you see here, there's foods and excess fructose, which really hurts your bowels.
Okay.
So those would be like apples, mangoes, pears, and different sweeteners like corn syrup and honey can also cause some problems. Lactose is one thing that if you were wanting to have, we could get you some lactate or something like that you would have before you eat it, and that would
Okay.
help you manage your symptoms. Over here we have some other foods that really irritate your stomach, like broccoli and Brussels sprouts. You see here, different vegetables to avoid would be sweet corn and mushrooms. And then over here we have stuff that you can enjoy, which would be bananas, blueberries, grapes, all of those fruits, these vegetables. Starch-wise, we try to focus on more rice and oats, and breads that are gluten-free would be really beneficial.
Okay.
We could try lactose-free milk, and they also have lactose-free ice cream because I know you like your
Yes,
ice
I
cream.
heard that almond milk is pretty good.
Oh, it is. And the ice cream, honestly, I can't even tell the difference.
We're trying it. We're trying it.
Okay. So another thing I suggest is looking into community resources for this diagnosis. There's a lot of different organizations such as the American GI Association and also IBS support groups that'll help you increase your knowledge on your diagnosis. And you can also connect with other people that have irritable bowel syndrome, which is really cool.
Connect about the fact we can't poop.
Yes. It's nice to have people that understand exactly what you're going through.
That's true.
So our goals are going to be just to follow this diet and increase your literacy on this diagnosis. That way we'll be able to tone down your symptoms so you can start feeling better and get out of here, because I know you don't want to be in the hospital.
I think we got a good understanding of what we can have.
Awesome. I'm so glad I could help.
You might, yeah. We don't even want those anymore.
All right.
Thank
Have
you.
a great day. Call me if you have any questions. I've left my phone number with the nurse, so if you need
Okay.
anything, just give me a holler.
Thank you.
Alright.
Thank you.
All right, so we're here to discuss Evan in room 3 about his diagnosis of IBS, and one of the nursing diagnoses I gave him was that he's at risk for constipation, which is related to his irritable bowel syndrome. And I gave him prune juice, and I made sure that he increased his water intake to 2 liters a day. And then I also gave him privacy for defecation.
240 milliliters of prune juice, or how much? 240.
Just 8 ounces.
8 ounces.
Yeah. And then he was complaining of stomach pain, and he said he hasn't had a bowel movement in 4 days. And before the interventions, his pain level was at a 7, and then it decreased to a 4.
Very good.
And he did have hyperactive bowel sounds in all 4 quadrants, and his abdominal is hard, and he experienced pain in all 4 quadrants.
Okay. How did the diet go?
It was great. They were very compliant. I talked to him and his wife about different options to decrease the symptoms. I gave him a pamphlet for the low FODMAP diet for IBS patients, and they seemed really willing to work with that. I also told him about some community resources out there for them, like GI foundations and different support groups for IBS patients, and gave them some more education so they can really manage those symptoms.
Perfect. Okay, and then how did he end up having a bowel movement today?
Yes, he did. He had a large bowel movement.
Large bowel
So he did meet his goal of that.
Was it firm?
Yeah.
Okay.
And then he also met his goal of decreasing his pain.
Okay, so for your nursing diagnosis, you did a really good job. Let's start with at risk for constipation related to the pathological process of irritable bowel syndrome. Why did we pick this one? Why is this one super important to us?
I chose this diagnosis because he's experienced a lot of pain, and I wanted to make sure that he had interventions that were necessary to reduce his constipation levels.
Yeah, that's very good. I agree. What was the other one you said you had?
I had another nursing diagnosis that was acute abdominal pain related to fecal impaction.
Oh, okay.
And
yeah.
the patient was showing a lot of objective and subjective data about his abdominal pain, so I felt that was important. He was grimacing during the palpation of the abdominal, and his abdomen did feel hard, and he also stated that his stomach hurt.
Okay.
So I wanted to make that a priority.
Perfect. That's a really good one.
And then
I think we have one more.
The last one I just wanted was that he was readiness for enhanced health management related to new diagnosis of irritable bowel syndrome. And him and his wife expressed to me that they were unsure of the diet that was required for this diagnosis, so I had to meet with a dietitian on that.
Good.
Oh yes, and I talked to them. They really seemed like they had a good understanding of what was expected of them to manage his symptoms, and I think that's a great nursing diagnosis for him, just to help manage his symptoms since this is a chronic condition.
Yeah, perfect. And you gave them the resources to call to and everything?
I did, yes.
Okay. And they understood it perfectly, you said?
Yes, they did.
Okay.
And I told them to call if they have any questions, so they should be good.
Sounds good. Great job, everyone.
Yeah, I think it's and a digital stool.
What's that?
Oh, pause.
You guys, on your new diagnosis, I know there's a lot to learn.